Hello, I'm James Salvante, an Emergency Medical Services Coordinator for the County of Sonoma. Thank you for joining the Medical Reserve Corps. This training will cover historical and potential threats, emergency management at the local, state, and federal levels, and disaster service workers. The Sonoma County Fire and Emergency Services Department coordinates Homeland Security grants, training and equipment for first responders, develops training for operational area partners, including the 15 volunteer fire companies consisting of more than 365 volunteers, oversees the Auxiliary Communication Service, which consists of about 140 operators, performs fire prevention building plan reviews and field inspections at new construction sites, promotes vegetation management programs and fire prevention education in the unincorporated areas of the county, and operates one of the two hazardous materials response teams in Sonoma County. The top four hazards in Sonoma County are earthquakes, floods, landslides, and wildland fires. A tsunami hit in March of 2011, but the only significant damage was in Humboldt County. There's also the potential for civil unrest, hazardous materials risks, and terrorist attacks. Much of the county is considered vulnerable to wildland fire and wildland-urban interface fires, where high fuel content is coupled with a dense population, and special vulnerability exists in the Fitch Mountain, Montecito Heights, and Sonoma Highlands areas. We experienced this phenomenon firsthand in October of 2017. Emergency operations tend to be dangerous, often cause injuries or even fatalities, result in property damage, and disrupt normal operations. The dynamic of disasters is a result of more than one emergency or incident. The need for resources outstrips their availability, and priorities must be set. Sonoma County has had many incidents that have resulted in disasters being proclaimed. There have been many activations of the Sonoma County Operational Area Emergency Operations Center, or EOC, and a number of local emergency proclamations since 1998. We have made 14 local emergency proclamations that resulted in 11 gubernatorial proclamations, 8 of which became presidential declarations of major disaster. 11 of the emergencies resulted in at least a partial activation of the EOC. Of the 17 emergencies identified in this history, 6 have been flood events, 3 winter storms, 2 wildland fires, 1 each for landslide, debris flow, an oil spill, a tsunami, civil unrest, drought, earthquake, and a public health emergency. In Sonoma County, disasters can be proclaimed by the county administrator and then ratified by the Board of Supervisors in order to protect life and property, request and receive mutual aid, and to provide legal protection from lawsuits. The governor may proclaim a disaster in order to enact emergency plans, suspend some statutes and regulations, provide state mutual aid, as well as financial relief. Disaster declarations by the President authorize federal essential assistance, individual assistance, and federal mutual aid. A presidential declaration is required for FEMA reimbursement of disaster costs. The initial phase of emergency management is to prepare for disasters in order to decrease their effects. The second phase is to respond by mobilizing all necessary services. Thirdly, emergency management helps with the recovery process following a disaster. Finally, the mitigation phase is an important component in preventing or reducing the effects of a disaster. During any disaster, the County of Sonoma has the following goals, listed by priority. First, to perform life safety measures. Then, to act to reduce property loss and damage to the environment. Then to act to provide for the rapid resumption of the operations of impacted businesses and community services. And additionally, to ensure there is accurate documentation and creation of the records required for cost recovery efforts. There is a single document that guides the Sonoma County response to any disaster impacting the county. It is called the Sonoma County Operational Area Emergency Operations Plan, or OpArea EOP. The EOP is divided into 3 parts. Part 1 explains the tools and systems used in emergency management, including Incident Command System, or ICS, Standardized Emergency Management System, or SEMS, the National Incident Management System, NIMS, as well as how Sonoma County structures local county government response to disasters. Part 2 provides a threat summary and assessment with a general description of local vulnerabilities. There are 16 hazards that are assessed within the plan. 2 assessments that are being added to the revision are the EAP and agricultural components. Part 3 consists of the legal documents that outline our authorities and responsibilities. This includes Board of Supervisors resolutions, memorandums of understanding, joint power agreements, and Chapter 10 of the Sonoma County Code. A glossary of terms and a definition of the abbreviation and acronyms used in the EOP is also included. There have been periodic updates to the EOP. For example, in 2006, it was updated to integrate the National Incident Management System to incorporate elements of the Local Hazard Mitigation Plan and to reflect operational realities. Another component of the Emergency Management Organization is the Sonoma County Operational Area Emergency Council. The Emergency Council meets semi-annually in May and November. The purpose of the Emergency Council is to meet state requirements to establish a local disaster council and authorize rules and regulations for dealing with local emergencies. Pursuant to Chapter 10, Sections 10-7 and 10-8 of the Sonoma County Code, the Emergency Council is empowered to study, revise, and recommend to the Board of Supervisors for adoption the county's emergency operations plan. The Emergency Council serves as the local citizen core council and reviews and recommends action upon all proposed mutual aid agreements for the operational area. The Emergency Council may recommend resolutions, rules, and regulations necessary to implement the county's emergency operations plan or any mutual aid agreement entered into pursuant to such plan. The primary way Sonoma County coordinates the dissemination of emergency management information is through the Sonoma County Operational Area Emergency Coordinators Forum. This forum consists of local, regional, state, federal agencies, both public, private, and nonprofit, acting as responders in our operational area. The forum meets quarterly, discussing and coordinating training and exercises, plans, capabilities, best practices, and projects to improve Sonoma County's emergency management response. Sonoma County Department of Fire and Emergency Services Emergency Management Division is the operational area's lead agency for emergency management in Sonoma County. One of the key roles of Emergency Management Division is to provide an informational conduit between first responders, local governments and special district, and the state and federal government for emergency management issues. The Emergency Management Division accomplishes this by using the operational area concept. In accordance with the Standardized Emergency Management System, or SEMS, the operational area, or OP area, includes all of the political subdivision within a county's geographic borders. All 9 of the Sonoma County cities, and the Sonoma State University, and Sonoma County Junior College District have signed an operational area agreement and a joint powers agreement to work together in their disaster response. Special districts are also integrated into the operational area EOC to assist and coordinate their specific roles and responsibilities. All of the cities, special districts, first responder agencies, and non-governmental organizations are referred to as OP area partners. The Emergency Management Division also maintains and provides Emergency Operations Center, or EOC, support to the cities and unincorporated areas of the county by assisting when they open their EOCs or by opening the operational area EOC. The California Office of Emergency Services has identified 6 regions to coordinate and support the 58 counties, along with cities and special districts located within those counties, that comprise the state's 58 operational areas. Sonoma County is organized within OES Region 2. As each level of government proclaims an emergency, assistance becomes available from the next higher level. At the highest level of proclamation, aid may come from other states and the federal government. An integral part of the EOP are the systems that the government uses to manage the disasters. These systems, the Incident Command System, or ICS, Standardized Emergency Management System, or SEMS, and the National Incident Management System, or NIMS, are part of a comprehensive national approach to incident management. In California, these systems are used by all jurisdictional levels, from city to county to state to federal and across all disciplines, from law, fire to EMS to public works and public health. Use of these systems ensures all stakeholders understand command reporting structures, common terminology, and roles and responsibilities inherent in emergency management response operations. ICS 100 is the introductory level course of the Incident Management System. ICS 200 is designed to enable personnel to operate efficiently during an incident or event within the Incident Command System. ICS 200 provides training on and resources for personnel who are likely to assume a supervisory position within ICS. ICS 700 introduces and overviews the National Incident Management System framework. NIMS provides a consistent national template to enable all government, private sector, and non-governmental organizations to work together during domestic incidents. Individuals with emergency management responsibilities including prevention, preparedness, response, recovery, and mitigation all participate. The Incident Command System, Standardized Emergency Management System, and the National Incident Management System are all elements of the disaster response system in Sonoma County. Since 2007, all county employees have received at least 1-hour orientation training on ICS, SEMS, NIMS, as well as information for individual and family emergency preparedness. This training incorporates elements from each of these systems, providing an introduction to the integrated response of government agencies in times of disaster. The intent of the training is to give the audience an awareness level of understanding of these systems and meet the requirements established by FEMA and the National Incident Management System. Together, these systems work to streamline, coordinate, control, and communicate throughout all levels in government and emergency management. In California, SEMS has its origins in the Incident Command System, or ICS. The Incident Command System was created to assist fire agencies in managing large wildland fires in Southern California in the early 1970s. Many of the ICS concepts were borrowed from large-scale military planning and strategy, and then adapted for use in these types of incidents. CAL FIRE and other fire agencies have experienced great success in managing large-scale fires using ICS, and it has become standard operating procedure to establish incident command on virtually all fire responses in California. ICS wide applicability across a broad spectrum of disasters encompasses all emergency management disciplines. Some key ICS concepts must be applied in disaster management. These ICS concepts are 5 functions. All ICS positions are organized into 5 functions: management, operations, planning, logistics, and finance admin. Management by objectives. In order for large operations to be effective, personnel must understand the goal they are working towards. By setting specific, measurable, attainable, realistic, and timely objectives, responders can understand and work toward the goal set and agreed to by the team. Action planning. To achieve goals and objectives, a plan is required. Action planning provides the specifics to accomplish objectives within the operational period. Flexible organization. Disasters are dynamic and require the ability for the organization to potentially change direction and focus quickly. Having a built-in capability to expand, contract, deploy, and demobilize units, branches, and groups as appropriate for the response is a key capability. County agencies and departments respond to all types of hazards and emergencies on a daily basis. In a response that requires additional resources or coordination, the OP area EOC may be opened and staffed, primarily with county employees. A critical element in considering who should staff a position within the EOC is whether they have adequate knowledge of their department, as well as county operations, can work well with other departments in a potentially stressful environment, and have the authority to commit their departmental resources to assist in the response. These are the 5 main functions of the 5 sections. Management makes decisions. Operations supports the field response, but doesn't directly tell the field responders what to do. Planning develops a detailed understanding of what the current conditions are and what the plan should be going forward. Logistics obtains the resources that the organization needs to accomplish goals and objectives: people, places, things, and materials. Finance and administration documents the incident, manages the payment, accounting for people, and ensuring that the organization qualifies for reimbursements and tracks resource use. A key element in large-scale multi-agency operations is determining which entity is in charge. ICS uses a concept called unified command that defines how agencies can work together and yet maintain their autonomy to some degree. It requires that all agencies and jurisdictions agree to operate under unified command and use a single action plan with common objectives. It provides commanders make joint decisions and establishes a single joint command structure. Unified command is a cooperative command process that works for consensus. It ensures that unity of command is maintained.
In California, the government uses the Standardized Emergency Management System, or SEMS, for response to disasters. SEMS was a byproduct of the East Bay Hills fire in Oakland in 1991. 2,137 houses were destroyed by fire in one of the most highly protected per capita areas in the world. One of the houses that burned down belonged to California State Senator Nicholas Petras. After the fire, Senator Petras introduced Senate Bill 1841, which created Government Code Section 8607 and mandated the use of SEMS for government response in order to receive state reimbursement for personnel costs associated with the disaster. All counties in California have since mandated the use of SEMS for their disaster response. SEMS combines many pieces of emergency management and facilitates the process of interacting with cities, other counties, and state agencies. Prior to September 11, 2001, the federal government did not use the Incident Command System to manage its response to disaster, making it difficult to interact with state and local government responders. It also did not provide a national standard to guide states and local governments with their disaster responses, creating additional complexities when dealing with large incidents requiring massive federal and state mutual aid. On February 28, 2003, President George W. Bush signed Homeland Security Presidential Directive No. 5, which enhances the ability of the United States to manage domestic incidents by establishing a single, comprehensive national incident management system. Fortunately for California, NIMS is primarily based on the SEMS model, requiring only additions and modifications to our existing response organizations. NIMS has also added training requirements for local government employees to be eligible for federal disaster preparedness grants. NIMS is now the standard emergency management system used throughout all levels of government in response to disasters in the United States. SEMS and NIMS are required by Sonoma County Code in order to receive state and federal reimbursement for personnel costs, to remain eligible for Homeland Security grants, and for public hospitals seeking financial recovery. Some decisions need to be made regarding the type of support functions that are necessary for an incident response. Initially, the incident commander determines the need for additional support. Once it is decided that further resources are needed, the incident commander would request a DOC activation through the department or an EOC activation at the city or county level. Our agreements in SEMS require us to open the op area EOC if asked by the city, or if 2 or more cities have activated their own EOCs. It must also be determined what level of activation should be undertaken. Is a minimal activation sufficient, or is a full activation necessary? This is where operational factors come into play. What is the threat and the likelihood of additional support needs? How many resources are necessary? Are there multiple agencies and jurisdictions involved in the response, requiring greater coordination? Is there a significant need for public information and risk communication? Concerning the activation of the op area EOC, these questions would be assessed by the emergency manager, the director of fire and emergency services, the sheriff, or the county administrator in order to reach a decision. Medical Reserve Corps volunteers are disaster service workers, meaning you are a non-paid county employee during a disaster. In order to respond during a disaster, it is paramount that you have a personal plan, a family plan, a disaster communications plan, and an emergency supply kit or go bag. When you are asked to deploy, you'll be informed of your job, where and when to report, whom to report to, and also who your supervisor will be. You have now met disaster service worker and MRC volunteer requirements. Our program and emergency operation plan have been approved. You've been registered and oriented, and you'll receive supervision when needed or requested. Please maintain your profile on the DHV Disaster Healthcare Volunteers website. Thank you, and thanks again for becoming an MRC volunteer. If you have any questions, please let the facilitator know.